Hello, my name is Dr. Fadia Shaya from the University of Maryland School of Pharmacy, and I would like to tell you about an exciting opportunity we have developed with just you in mind. It is called the MVP, Maryland Men's Cardiovascular Promotion Program. I would like you to take a few moments to watch the following. Do it for your heart. You will not regret it.
Keep your head in the game, know your number, know your score, and compete to win. Not only on the court or field, but in life.
I hate to say so, we blacks have really got to make a change because they're going too fast.
Heart disease is the leading cause of death among men. People most at risk for hypertension that leads to heart disease are athletes, the obese, those with high salt diets, or with family histories, and African American men between the ages of 35 and 64.
The lowest life expectancy among demographic groups is among African American men. And you might think that, maybe that's because of the city's homicide rate or something like that. But in fact, when you look at the numbers, the reason that more men are dying before their time is heart disease.
In fact, in 2005, heart disease killed 576 African American men in Baltimore City compared to 378 white men. Deaths from stroke and diabetes were more than double that of whites. According to the statistics, 1 out of 6 black men in their 30s has hypertension. And by the time they reach their 50s, almost 60% are affected. You could be suffering from hypertension right now and not even know it.
For many years, you may have no symptoms at all, but if it's left untreated, some of the devastating complications are heart attacks, heart failure, kidney failure leading to dialysis, strokes. Diabetes often makes its appearance in a silent way. People don't know that they have it. High cholesterol in the blood, which leads to heart attacks, makes its appearance very silently. And the interesting thing, all three of those problems, hypertension, diabetes, and cholesterol problems, tend to run together frequently. Among males, we've had probably more of a problem with this area because macho, nothing's wrong with me, I feel great. Going to a doctor, taking medication, says that I'm not very strong, I'm not a man. And we have to overcome that.
Here's how you can take control of your health. The first step is becoming an MVP.
If you're diabetic, you really need to get it below 130/80.
Doctors in pharmacy at the University of Maryland School of Pharmacy conduct classes with MVP, or Maryland Men's Cardiovascular Health Program. It's a long title for easy and powerful workshops that teach patients how to empower themselves by learning how to control and treat their hypertension. Wally and Arlene McCain encourage their whole family to join.
It teaches you how to control your blood pressure, eat, exercise, different things that you really need to do for your body. And it's for the better.
Patients, both men and women, are grouped into teams. They learn how to take their blood pressure and what the numbers mean. They later recruit 2 people from their community. The goal is to get healthy and lower your blood pressure score through diet, exercise, and medication. The team with the best score wins in more ways than one. The program is sponsored by Care First Blue Cross Blue Shield.
This program has a lot of promise in that way, just from the way that it's designed to spread knowledge and spread information and spread the ability to make changes in one's life.
If someone thinks they're having a stroke,
We'll start with 40 patients who will be trained by doctors in pharmacy on identifying others who can benefit from the hypertension counseling. They recruit 2 friends who will be followed up by peer educators. 6 months later, the trainees are ready to recruit. The cycle repeats itself, and 2.5 years later, we end up with 600 patients, all competing towards a better blood pressure score and better overall health. Care and medications are made available by Bon Secours and Total Health Care. We got you covered. The MVP program is about access to the training and medications you need to live a healthier and longer life.
It's time for a change. And the change is now. You can do it. Only thing you have to do is just make up your mind.
Now you decide. Do you want to play in the game or just watch from the sidelines? Take control of your health and your hypertension. Know your number, know your score, and compete to win in the battle of your life.
Well, I hope what you have just watched will inspire you to become an MVP. You can improve your life and your health, but remember, you're in charge. Call us here at the University of Maryland to find out how you can become an MVP and win the battle with hypertension and diabetes. Do it for your heart. Know your meds, know your number, know your score.